Warning: 10 vitamins that may be quietly harming your health after 65. Have you ever wondered if the supplements you take daily are actually protecting your health? What if I told you that some popular vitamins may be secretly causing damage to your body after the age of 65? Could you identify which supplements in your medicine cabinet could be shortening your life instead of prolonging it? The supplement industry moves billions of dollars annually, promising health, vitality, and longevity. But what manufacturers don't tell you is that after the age of 65, your body processes nutrients completely differently. What you learn today can literally save your life or that of someone you love. Recent research from Harvard University and the Mayo Clinic reveals that certain supplements considered essential can pose serious risks to the elderly. Did you know that more than 70% of Americans over the age of 65 take at least one supplement daily without medical supervision? Let's unravel together which vitamins may be quietly harming your health and what to do about it. Let's get started. 1. Vitamin A, the nutrient that turns into poison in the elderly body. Vitamin A is known to benefit vision and strengthen the immune system at all ages. However, after the age of 65, your liver can lose up to 30% of its ability to process this nutrient. The elderly body stores vitamin A in adipose tissue and liver, where it can accumulate to toxic levels with ease. Studies from Columbia University show that the elderly have 3 times the risk of hypervitaminosis A, even at doses considered safe for young adults. Too much vitamin A can silently damage your liver before any symptoms appear. Symptoms such as headaches, blurred vision, and joint pain are often mistaken for normal aging problems. Chronic toxicity can lead to severe liver problems, osteoporosis, and even increase the risk of fractures by 25%. Products like cod liver oil, retinol supplements, and potent multivitamins are the main villains. For seniors, getting vitamin A through foods like carrots, sweet potatoes, and green leafy vegetables is much safer. These foods contain beta-carotene, which the body converts into vitamin A only in the amount it needs. If you take vitamin A supplements, see your doctor immediately to check if the doses are appropriate for your age. A simple blood test can reveal if your levels are already elevated, preventing permanent damage. But what if I told you that another famous antioxidant could also be causing invisible damage to your vital organs? 2. Vitamin E, the miracle. Antioxidant that may be shortening your life. Vitamin E is celebrated as a powerful antioxidant that fights aging and protects the heart. Marketed as the elixir of youth, this vitamin has gained popularity among elderly people concerned about cardiovascular disease. Surprisingly, extensive studies with more than 135,000 participants have revealed alarming results. Doses greater than 400 IU daily increased overall mortality in people over 65 years of age. A study published in the Journal of the American Medical Association found a 17% increased risk of heart failure. Vitamin E in high doses can transform from a protector into a promoter of oxidative damage in elderly cells. Researchers at the University of Oxford found that vitamin E can interfere with commonly prescribed anticoagulant and antiplatelet medications. This dangerous interaction significantly increases the risk of internal bleeding in older people. Synthetic forms like alpha-tocopherol acetate, found in most supplements, are particularly problematic for aging metabolisms. The reduced ability of the elderly liver to metabolize vitamin E can lead to toxic levels even with moderate supplementation. Foods like avocados, almonds, and olive oil offer natural vitamin E in safer, more bioavailable forms. Studies show that low doses obtained through food have beneficial effects, while concentrated supplements have risks. If you currently take vitamin E supplements, consider replacing them with natural food sources. Now, are you ready to discover how an essential mineral can become a silent poison after 65? 3. Hidden iron. How this essential mineral can become your worst enemy. Iron is critical for transporting oxygen around the body and maintaining your energy levels. During youth and adulthood, many struggle with iron deficiency, especially women of reproductive age. However, after the age of 65, the female body undergoes a dramatic transformation due to menopause. Without monthly menstrual cycles, older women begin to accumulate iron just like men. Studies by the National Institute on Aging show that 40% of older adults unknowingly have elevated iron levels. Excess iron acts as a powerful oxidizing agent, causing inflammation and cellular damage throughout the body. Excess iron can be deposited in the heart, liver, and brain, potentially accelerating conditions such as Alzheimer's and Parkinson's. Research from Stanford University reveals that high iron levels can increase the risk of type 2 diabetes by 30%. Many multivitamins for seniors still contain iron, based on outdated information on nutritional needs. Over-the-counter iron supplements are especially dangerous for people over the age of 65. Even iron-fortified foods, such as breakfast cereals and fortified breads, can contribute to this dangerous excess. Iron absorption increases dramatically when taken with vitamin C, creating a potentially harmful combination in the elderly. If you haven't had your period in years, avoid iron-containing supplements unless your doctor has diagnosed a specific deficiency. Have you ever thought that the most recommended vitamin for the elderly may be causing more harm than good? 4. The vitamin D trap. Why more may be destroying your bones. Vitamin D is often referred to as the sunshine vitamin and praised for its importance for healthy bones. Doctors routinely recommend vitamin D supplements for the elderly, especially to prevent osteoporosis and falls. However, recent research from the University of Auckland reveals that megadoses can be harmful after the age of 65. Clinical studies with more than 5,000 elderly participants have shown that doses greater than 4,000 IU daily increase the risk of falls. Excess vitamin D can paradoxically weaken bones and damage kidneys already compromised by age. High-dose vitamin D mobilizes calcium from the bones when there is not enough calcium intake in the diet. This effect may accelerate bone loss rather than prevent it, especially in older adults with low calcium intake. Reduced kidney function, common after the age of 65, makes it difficult to eliminate excess vitamin D and calcium. The result can be calcification of soft tissues, including kidneys, arteries, and even heart valves. A study published in JAMA in 2022 found a 25% increase in hospitalizations for hypercalcemia. The researchers linked this increase to the increasing use of high-potency supplements among older Americans. Moderate doses between 800 and 2,000 IU daily are considered safe and beneficial for most older adults. Before starting any vitamin D supplementation, perform a blood test to determine your current levels. But what about the vitamin that can turn a life-saving drug into a life-threatening one? 5. Vitamin K, the supplement that can cause a medical emergency. If you use blood thinners, vitamin K plays a crucial role in blood clotting and bone health throughout life. Recently, vitamin K supplements have gained popularity among seniors concerned about osteoporosis and cardiovascular health. However, for the approximately 20% of seniors who take blood thinners like warfarin, these supplements pose a serious danger. Warfarin, Coumadin, works precisely by antagonizing the effects of vitamin K in the body. Vitamin K supplementation can completely neutralize medications that prevent potentially fatal blood clots. Studies by the Mayo Clinic have documented hundreds of cases of medical emergencies resulting from this dangerous interaction. Even small changes in vitamin K intake can destabilize blood clotting time in patients using blood thinners. Vitamin K supplements too, promoted for bone health, are particularly problematic because they are rarely mentioned to doctors. Many patients are unaware that natural supplements can interfere with prescription medications, increasing the risk of stroke or pulmonary embolism. Green leafy vegetables like kale and spinach are high in vitamin K and should be consumed consistently, not eliminated. The key for patients on anticoagulant therapy is to keep their vitamin K intake stable, not necessarily low. Always consult your cardiologist before starting any supplement, especially if you take heart medications. A simple adjustment in the dose of the blood thinner may be necessary if you decide to increase your vitamin K intake. Now, get ready to find out how a B-complex vitamin may be silently attacking your nervous system. 6. The dark side of vitamin B. 6. How this nutrient may be attacking your nerves. Vitamin B6 is essential for protein metabolism and neurotransmitter production in the brain. Known to aid cognitive functioning, this vitamin is often included in brain health formulas aimed at the elderly. Researchers at the University of Oxford have found that doses above 100 milligrams daily can cause toxic sensory neuropathy. This nerve damage manifests itself as numbness, painful tingling, and loss of sensation in the hands and feet. The aging nervous system is particularly vulnerable to vitamin B6 toxicity, even at moderate doses. Alarmingly, many supplements for seniors contain doses far above the recommended daily requirements of 1.7 milligrams. Studies show that more than 20% of cases of unexplained neuropathy in the elderly are linked to excess vitamin B6. Most worryingly, the damage can be irreversible if supplementation is not stopped quickly. Elderly people with reduced kidney function are at even higher risk as they eliminate this vitamin more slowly from the body. Symptoms of toxicity are often mistaken for diabetic neuropathy or side effects of statins, delaying correct diagnosis. Food sources like bananas, chicken, and chickpeas provide vitamin B6 in safe amounts and more bioavailable forms. If you experience unexplained tingling or numbness, review all of your supplements with your doctor immediately. The good news is that stopping excessive supplementation early usually allows for a full recovery within a few weeks. Are you ready to know the truth about the most consumed vitamin by American seniors? 7. Excess. Vitamin C, the price your digestive system silently pays. Vitamin C is celebrated for strengthening the immune system and protecting against colds and infections. Popularized by Nobel laureate Linus Pauling, high-dose vitamin C supplementation has become common among the elderly. However, after the age of 65, the digestive system undergoes significant changes that increase sensitivity to this vitamin. Studies by the Center for Geriatric Research reveal that doses above 1,000 milligrams often cause gastrointestinal disorders in the elderly. High-dose vitamin C can severely irritate the gut lining already weakened by age. Diarrhea, abdominal cramps, and nausea are common reactions, but often misattributed to other conditions or medications. Researchers at the University of California found that older adults with a history of ulcers or reflux are at particularly high risk. The acidic form of vitamin C, ascorbic acid, found in most supplements may exacerbate pre-existing gastric conditions. Surprisingly, high doses of vitamin C can interfere with the absorption of copper and other minerals essential for brain health. Recent studies suggest a possible relationship between chronic excess vitamin C and kidney stone formation in predisposed people. For the elderly, moderate doses between 200 and 500 milligrams offer immune benefits without significant digestive risks. Buffered or liposomal forms of vitamin C are gentler options for sensitive digestive systems. Citrus fruits, kiwi, and bell peppers provide natural vitamin C along with fiber and other nutrients that aid their proper absorption. Now, get ready to discover the dangerous interaction that may be happening inside your body right now. 8. The dangerous dance. How your meds and vitamins may be fighting a deadly battle. Americans over the age of 65 take an average of 4 to 5 prescription drugs daily. When vitamins and supplements enter this equation, the potential for dangerous interactions increases exponentially. Researchers at Johns Hopkins University found that 63% of seniors never tell their doctors about supplements. This miscommunication creates a perfect scenario for potentially fatal drug interactions. Each pill you swallow may be silently altering the effect of all the others on your body. Garlic, ginkgo biloba, and coenzyme Q10 supplements can dangerously potentiate the effect of blood thinners like aspirin and warfarin. Calcium and magnesium, often recommended for bone health, can block the absorption of antibiotics and thyroid medications. B vitamins can reduce the effectiveness of certain Parkinson's medications, compromising motor control. Potassium supplements, common in blood pressure formulas, can cause fatal arrhythmias when combined with certain diuretics. Ginseng, popular for energy, can destabilize blood sugar levels in diabetics and interfere with psychiatric medications. Hospitalizations for interactions between supplements and medications have increased 170% in the last decade among the elderly. Keep a complete list of all supplements and medications and share it with all the healthcare providers you consult. Drug interaction apps can help, but nothing replaces personalized guidance from a pharmacist or doctor. Do you still believe that that daily multivitamin is actually protecting your health after 65? 9. The Grand Illusion. Why common multivitamins can be a threat. After 65 multivitamins are often seen as health insurance in pill form, especially among the elderly. Marketed as a one-stop solution for nutritional needs, these generic supplements ignore the profound metabolic changes of aging. A comprehensive study published in the Annals of Internal Medicine followed more than 38,000 women for 25 years. The results were surprising. Multivitamins did not reduce mortality, cancer, or cardiovascular disease in the elderly. The standardized formula of common multivitamins may be providing nutrients you don't need and lacking the ones you do need. Many multivitamins contain iron that is unnecessary for postmenopausal men and women, increasing the risk of iron overload. The synthetic forms of nutrients found in these supplements are often less bioavailable to aging digestive systems. Doses of water-soluble vitamins such as B and C often exceed daily requirements, straining kidneys already compromised by age. Ironically, crucial nutrients for seniors like vitamin B12, vitamin D3, and magnesium are often in inadequate doses. Researchers at Tufts University found that multivitamin supplements can create a false sense of nutritional security. This can lead to less healthy food choices, with potentially serious long-term health consequences. A study from the University of California showed that multivitamin consumers ate fewer fruits and vegetables than non-consumers. Before automatically renewing your multivitamin bottle, consider a personalized nutritional assessment with a qualified professional. Now, let's figure out how to find the perfect balance for your specific needs after 65. 10. The safe way. Discover the supplements that actually protect your longevity. After the age of 65, your nutritional needs become highly individualized based on your health, genetics, and lifestyle. The one-size-fits-all approach to supplementation is particularly unsuitable for the aging body. Comprehensive blood tests can reveal your specific deficiencies, allowing for targeted and personalized supplementation. Studies show that only about 15% of older adults have similar nutrient profiles, highlighting the need for individualized approaches. Optimal supplementation after age 65 should be as unique as your fingerprint. Vitamin B12 is often needed, as 30% of seniors lose the ability to absorb it properly from food. Vitamin D, in moderate doses, 800 to 2000 IU, benefits most seniors, especially in climates with little sun exposure. High-quality omega-3 fatty acids may offer significant anti-inflammatory benefits for joints and cardiovascular health. Magnesium is often deficient in modern diets and crucial for more than 300 functions in the aging body. Specific probiotics for the elderly can improve nutrient absorption and strengthen the intestinal immune system. Consult a geriatrician or dietitian who specializes in aging before beginning any supplementation regimen. Consider formulas specifically designed for older adults, which take into account metabolic changes and common drug interactions. Remember that even the best supplements never replace a diet rich in whole foods, vegetables, lean proteins, and healthy fats. Their best strategy is an integrated approach: nutritious eating, regular exercise, adequate sleep, and selective supplementation when needed. Now that you know the hidden risks of certain vitamins after age 65, you're in a prime position to make informed decisions. Remember that knowledge is power, especially when it comes to your health and longevity. Healthy aging does not come from a bottle of pills, but from conscious choices based on scientific evidence and your individual needs. Everybody ages in a unique way, and its nutritional needs are as individual as its life story. Share this information with your loved ones over the age of 65. You can literally save a life. Schedule an appointment with your doctor this week to review all of the supplements you currently take. Question, research, and never accept generic recommendations when it comes to your health after 65. True vitality in old age comes from balance, personalized nutrition, daily movement, social connections, and life purpose. You have the right and responsibility to be the greatest advocate for your own health at any age. The future belongs to those who inform themselves and make decisions based on evidence, not on marketing or passing fads. Invest your time and resources in personalized analysis and professional guidance. It's the best gift you can give yourself. Your journey to truly healthy aging starts now, with every informed choice you make. May this new wisdom guide you to decades of vitality, mental clarity, and independence that you deserve to enjoy.